welcome to Noskoshola Health and Career Consulting. How are you today? So today's topic is straightforward and it's something that has actually been in my mind for a long time. It's actually Tracy, basically health information. As your health information coach, I'm bringing you today's topic. What should you ask your nurse or your doctor or anytime you go to the hospital? What are the questions you should ask? What are the things you should ask? So if you are new here, please subscribe to this channel, like, comment, very important. Just ask something, make a contribution, and of course, share. All right, so I'm going to start this way. I've been kind of bothered about some things that happen, especially in my home country, and what I've experienced myself. Most times, patients in court, so to say, find it difficult to comprehend what their doctor or their nurse tells them. And I've had some family members, some friends come to me and are like, oh, I didn't understand what the doctor said. Why didn't you ask? When you ask some people, what medication are you on? They don't even know the name. Some people don't even know the side effects of their medication. Some people don't even know what to do if they have a side effect, an adverse reaction, that kind of a thing. So that really brings me to this, we need to talk about this. We need to talk about it. It is literally health information. What should you ask? What should you know about your health? So we started this at the Health and Wellness Initiative from PPM. So I'm bringing this down to you. Let's know what are the questions you need to ask your doctor or your nurse. All right. So I've put up about 10 things, which is actually not the maximum, and you can still have a lot of questions, but I just put it up together. What you should ask your nurse or a doctor. To start with, I am a nurse, of course. Nurses provide healthcare for patients of all ages. We do that from all walks of life, from the beginning of their life to their end. And everything in between, we are just everywhere. So you can help your nurse by being that kind of patient that asks questions. I find it very difficult as a nurse if my patient is not talking to me. So we want to know more about you. We want you to ask questions. That is what your nurse and your doctor want you to do. So, but if you're not asking, you're not really helping. All right, so here are 10 things that you should ask your nurse or your doctor to get your optimal care. Now, I want to start with this, that know that you are in charge. Most people have said that, oh, it is what my doctor says, it's what my nurse says. Oh, my nurse says this, my doctor says that. The first thing you should know is that you are in charge of your health. Never forget that. You are in charge of what happens to you. That's the first thing. The doctors, your nurse may advise you, they can provide an opinion, they can suggest treatment, but you make the final decision regarding your health. Okay? So, how do you go about that? It is by honing up, asking questions, preparing yourself for your appointment. That makes you put yourself in that, I'm in charge. Ask questions, get feedback, and that is it. So, to summarize, number one, you are in charge. All right. So, secondly, you should know that second opinion matters. Second opinion matters. So even though your doctor might have told you about an option of treatment or have told you the diagnosis, the test, don't be afraid to ask for a second opinion. They are routine. It is your right as a patient to get one. And your doctor won't be offended. So it's not like, oh, they won't let me do it. So try to get a second opinion. If you've been diagnosed of a particular condition and you have some queries, get a second opinion. That will help you to make your final decision about your medical care. For instance, if you have prostate cancer, you can choose from different arrays of options, maybe active surveillance, chemotherapy, or drug therapy. It depends on you. Okay, so get a second opinion, number two. Now, the third thing I'm going to tell you today is you need to be your advocate, your own advocate. Yes, we have so many patient advocates. I hope I'll be one. patient advocates out there that advocate for the need of the patient, but you should be your own advocate. How do you do this? If you ask questions about your prescription, about something about your treatment, you are free to talk about it. Let's not be that kind of patient that will just sit back and let things happen to them. Like I told you, I've actually experienced it. My family, this is kind of emotional for me right now, like having to go through a particular treatment and then there's a side effect, adverse reaction, and we just take it like that. So be your own advocate, ask questions. It is very important. It may take time to find the right medication or the right dose. Sometimes the doctors, the nurses, they give you medications, they give you your drugs. Just ask questions. And if you're not okay with any treatment plan, please be your own advocate. Number 3. Now, the fourth thing I want to talk about here is you are free to get support. Going to an appointment could be very, very frightening, anxiety, all that kind of thing, especially when you have some symptoms, you're waiting for a result. It is okay for you to request to have a support, to have a friend. Bring a friend along, bring somebody along with you, that could be of that kind of support to you during your appointment. So it is okay to ask. So don't feel like, oh, they won't let me bring anybody. No, it is one of the things you can do. Ask for support. Probably after your treatment, you could ask for support even after discharge. So these are some of the things you can do. So number 4 is what? Get support. All right. Number 5 is, I call it follow the rules. Now, talking about questions, whether it's taking prescription medicines, abstaining from certain food, getting enough exercise, you've been given all these instructions. We give a lot of instructions in the hospital as nurses, as doctors, do this, do this. These are just to help you, get better. But then it is up to you to ask questions about them. You can ask questions about your medication. You can ask questions about the type of exercise you should do. If you have any query, ask. But most important thing, follow the rule. All right? Follow the rule. If you have any kind of query with this thing, for instance, you are told to maintain Renner diet. For God's sake, what is Renner diet? You should ask, what is Renner diet? What are the things I have to do? What are the things I have to put together? Ask questions. That is what this is all about. Asking questions. No amount of questions can be too much. Though we have some patients that ask numerous questions, but we know the relevant one, and we pick this, and this helps your nurse, it helps your doctor to provide appropriate care for you. Number 6, don't make assumptions. Never you assume that maybe your nurse or your doctor is perfect. Now, let me tell you something. A friend of mine took a daughter to the hospital, and apparently that girl has some abdominal pain, tummy ache, and the doctor just checked, did the palpation, did everything, and okay, I wrote some drugs on the paper, give it to the nurse, and then the nurse gets this medication. Now, the most awkward thing that I heard, there is no name on the drug. There is nothing, just prescription like take 1 to 1, one in the morning, 1 in the night, 1 in the evening. No name. So, and when she told me, the first question I asked is that, what is the name? What drug is your daughter using? She said, oh, there's no name on it. I was like, what? There's no name on the drug. So I don't know why, honestly, I know there are good doctors out there, but I don't know why some doctors do this. You're giving out a medication to your patient without a name. Why will you do such? No name. And some people say it's because they don't want the patient to know why, the name of the drug, so that they don't go and buy it outside. It doesn't make sense. It doesn't make sense. So it is your right as a patient to ask, what is the name of the drug I'm taking? What are the side effects? How many doses can I take? What happens if I overdose? Ask all these questions. And of course, she never even knew the diagnosis. She just said, the doctor said something stomach. Something stomach. Does that make any sense? So please Ask question, what is my diagnosis? What does it mean? And I'm very sure your doctor, your nurse will be so kind and, professional enough to explain this to you. All right. So, like I said, don't make assumptions. They are just human like you. They can make mistake with your diagnosis. They can make mistake with the test results. Doctors, nurses, they make mistake even with drugs. There are medication errors everywhere. So that is why you should be your own advocate, and you should not make assumptions that your doctor or your nurse, they are the best or they know what they're doing and all that. Fine. We know what we are doing. Don't get me wrong. We are professionals. But, you can never be so too much careful. All right. Number 7. Yeah. There are smart questions you can ask. Yeah. I've mentioned some of it. Like you can say, what is my main problem? What is my main problem? What's that? What does it look like? You can also ask, like, what is the prognosis? How soon can I get better? All this kind of thing. Ask the question. You can ask, what do I need to do now about it? You can ask, why is it important for me to do it? Ask all these like smart questions. These are the 3 smart questions. I got this from a writer by Joanna Miller. So it says that you can ask 3 smart questions. What is the main problem? What do I need to do about it? And why is it important for me to do it? All this will give you better understanding of your condition, and it will give you a kind of confidence that you are in control of your health. That is number 8. Now, number 9, we're almost there. Number 9 is don't rely on Google for medical advice. Oh my God. I know I do this sometimes myself, even as a nurse. You just want to get some random response or answer. Especially, I have a friend, as a pregnant woman, everything is Google asking, what is this? Why it is good to get information. It's fine to use search engine. It's fine to seek for direction to your doctor's office, but you should not rely on it for medical information. Why? Medical information you find on a Google search may not be accurate. It may not be relevant to you. It may not be from credible source. So it may only tell you part of the story, but it might not be directly relating to you. So always rely on your medical provider for information about your condition or treatments. Don't you rely on Google or for medical advice. Don't. If you do that, you need to stop. Okay. Now, number 10 is know your medications. I'm putting this separately because, like I've mentioned, it is very important. A very close relative of mine has suffered from this and actually lost her life to this. Know your medication. What are the things you need to know? Know the name of your medication, know the dosages, the usage frequency. You can ask your nurse about this. And I'm very sure, like I said, professionally, we will tell you that. You need to know what medications you are taking. Like, you need to know about them. You need to know what side effects. You need to know, what if I react to this? And that brings me to the point of asking, like, do you even know the difference between a side effect and allergic reaction? Because people just say, oh, I'm allergic. What if you're asked, are you allergic? Do you have any allergy? Most people say, oh, I don't know. It's fine if you don't know. So you should always tell, I don't know. Or if you have any, make sure you are telling your doctor. So, or tell your nurse about it. It is very important. It's going to help so that you don't get the wrong medication and you don't suffer from, consequences as a result of adverse reaction. All right. As a recap, before I go to that, actually, it is important that you tell your doctor whatever medications you are on. I'm talking about know your medications. So if you are taking any previous medication, past medications that you have taken, either herbal treatment, homeopathic remedies, or any other medications that you are taking on your own before coming to the hospital, you should declare it. We want to make sure that one medication does not negatively, interact with another. I think I'm going to invite a pharmacist one day to talk about this, especially when it comes to drug overuse, overdose, abuse, things like that, difference between side effect and allergen and how this can relate. So it is important, of course, we want to know the medications that work for you, when they work for you, how they work for you. So that's why it's important that you should ask these questions. So thank you once again. That's going to be the wrap up of it from your nurse coach Ola, health information and career coach. So today we have talked about what questions you should ask your nurse or your doctor or anytime you go for an appointment. Till next time, if you have any question, please use the comment section in on the page, subscribe to this channel, like, and of course share. Hi, bye, stay safe.